Our next guest is Dr. David Mckalip, and David appeared on my program when we were fighting the Obamacare fight last fall. David knows what he's talking about. He's a practicing, he's not, I hate to call him a physician, he is a brain surgeon. You know, all too often you hear about it doesn't take brain surgery. Well, this man is incredible. He is the past president of the Florida Neurological Society. He serves on the board of the Florida Medical Association, and he has served on the Florida delegation to the AMA's key policy-making body, the House of Delegates. He also served as an officer of the Pinellas County Medical Association for 3 years. This bio goes on for 2 more pages, but I don't want to waste time. I want him to talk to you. Dr. David Mckalip.
Hello, Patriots. Hello, fellow lovers of liberty. I'm so happy to be here. Thank you for fighting for freedom. Thank you for standing up for America every day. You know, a lot of people are angry. A lot of people are mad, but I'm filled with another feeling. It's a feeling of hope, because I see freedom fighters like you ready to take back our country. Thank you. Now, this is an historic time for America, an historic time for medicine, because what's happened is the government and the corporations have taken over 1/6 of the country's economy, and they have nationalized health care. This is a collectivist dream. That's right, nationalized health care, and it is a cornerstone for collectivism, which has been the progressives' dream for decades. And when they take hold of your health care, they're really taking care of your private, your personal lives, your very lives is what they're taking. Are you going to let them take your lives from you? No! And that's why we have to fight, and we have to remember that this is the latest battle in an epic war between collectivism and individualism. We have 2 competing philosophies, and we have to look at this like the 4th game of the World Series. We lost the first game in 1913 when they created the Federal Reserve and the income tax. We lost the second game in the New Deal when FDR scammed the country and unemployment was the same at the end of Depression as it was at the beginning of the Depression, and we lost that second game too. And we lost the 3rd game of the World Series when in 1965 Lyndon Johnson pushed through the Great Society and the scam and the con job of Medicare and Medicaid that is now $38 trillion in debt. They took your money from your payroll, every paycheck. They took the money, they spent it on bridges to nowhere. That's why the first 3 letters of Congress is con. You've been conned, America. And this is our final game in the World Series, the latest American collectivist agenda in this 100-year war with Obama and Pelosi and Reid and their agenda trying to take over our very freedoms. And we remember that in collectivism, the power and the money are in the hands of a group as opposed to the individual. And everything about this health care bill is a collectivist dream. And they have total contempt for America. Congress has contempt for you because they heard the message loud and clear. As each one of you were ringing the phones off the hook, as each one of you were marching on their offices, as each one of you were in the town halls, they did this. We don't want to hear it. We don't care what you say, America. We're Congress and we know better than you. That is abject contempt. Well, I have a message for Congress. Congress, America holds you in contempt and your days are numbered. So what did they pass? What they passed will increase your costs, not drive them down. What they cost will make it harder to find a doctor, not make it easier. What they pass will put a barrier between you and your doctor, will have you looking over your shoulder, and will burden your children with debt for generations that they can never get out of. Is that change you can believe in? No! So let me give you 5 things that you need to know about this bill. The first thing they did was they nationalized health care. They took the entire industry of the health insurance industry and they brought it under federal control. Instead of having dozens of health insurance plans that compete across state lines, you get, in 2016, 4. You get 4 plans. You get a bronze, a gold, a silver, or a platinum. Those are the 4 you get to choose from, and they cost more and more at each level. And Right now, the cost of health insurance for a family of 4 is already way too high, $12,400, but under their plan, according to the Congressional Budget Office, that cost will be $19,100 out of pocket in order to get the full benefit of your health plan. That's $5,000 out of pocket to get the health plan and $14,000 in premiums. And they will mandate that you will buy what they tell you to buy, or they will tax you or fine you and put you in jail if you don't pay the fine. And they want to create an entitlement generation, another entitlement generation, by giving subsidies to 60% of America to buy health insurance. People who earn, for a family of 4, $90,100 a year will get voucher checks from the government to buy the mandated, overpriced, low-value health insurance. That is not free market reform. And this reform has been tried in Massachusetts, and it has failed, where costs are up, people are going to the ER more, waiting lines are growing, rationing is occurring, and they get federal bailouts. And this came in under Mitt Romney, a Republican, and that's why I will never support Mitt Romney for president until he apologizes to America and admits he was wrong in Massachusetts. What else did they pass? They passed budgets for doctors and for patients. They said to the doctor, you shall not spend more than $10,000 on a heart attack for your patient. You shall not spend more than $5,000 for back pain. If you dare to spend a penny over, we will penalize you. We will cut your pay 5%, 10%. We will put you in the newspaper and call you inefficient. You won't be able to trust your doctor because your doctor will always be looking at their wallet before they look at your care. That's not the kind of care that I expect to give my patients, and I refuse to participate in that system. So we've seen 2 things they've passed. Nationalized health insurance, budgets for patients and doctors, and then they've created committee medicine. And they call it pay for performance, where we're going to pay the doctor more if he decides to follow the committee medicine. Well, the people on these committees are people like Zeke Emanuel. You ever heard of Zeke Emanuel? Yeah. Rahm Emanuel's brother? Yeah. Zeke Emanuel wrote a paper called The Complete Life System. And he said that when medical resources are scarce, and believe me, they will be scarce under this plan, that we will use lotteries, age discriminations, and some expert committee's opinion on what quality and value is. And he has a curve in his paper, and up to age 15 you don't get as much care, and after age 40 you don't give as much care. Well, that's not American health care. That sounds awfully dangerous to me, and I reject your plan, Zeke Emanuel, and so does America. By punishing doctors for not complying with committee medicine, they force hospitals and doctors to comply with dangerous measures. There was one that told doctors that you must give a beta blocker within 24 hours of a heart attack. That's great for a lot of patients, but not for the wrong patients. That measure killed patients for 4 years. It took the government 4 years to retire that measure after hurting lots of people. We don't need committee medicine. Medicine is between you and me, the doctor and the patient. No, that's right. No committee ever had to look the patient in the eye and tell them about whether they had to have surgery for a brain tumor or whether they want something else. No committee ever had to wait outside the room of a dying patient after they just told the patient's family that it was time to stop. No committee ever had to have that difficult talk about deciding what medicine to use and which medicine not to use. No committee can practice medicine. It's between you and your doctor.